There's a new procedure right here in Thomasville, or in Thomasville rather, for people with chronic sinus problems. It's called a sinus balloon, and today we have Dr. Berger here to help us with this amazing new procedure called the sinus balloon, and it looks relatively simple. But
Well,
for you're saying that this small procedure could help people breathe better.
Well, it can do a few things. It is a technique that takes the sinus openings that we have that for one reason or another become narrow or blocked completely, which leads to sinus infection. And this permits us, using a very simple technique that we borrowed from our colleagues in vascular surgery, to introduce a deflated balloon into the blocked sinus opening and then gently inflate this balloon to dilate the opening, and this does the job without creating tissue damage or tissue removal and bleeding and other things that involve much more of a healing process.
Now, once you do this, what's the downtime for this kind of process? What would it be?
I allow my patients to take the afternoon off.
Just the afternoon?
They usually find to go back to work the next day.
And typical sinus surgery before it really took some time. It was invasive, yes?
It is invasive, and this does not replace conventional sinus surgery. This is a procedure that's meant to help certain select cases where it's applicable. It does not replace or supersede what we were already doing in the operating room. What's different about this is that we can do this in the office under a local anesthetic with a little oral sedation, kind of like what the dentist does, and we can accomplish some of the same things without the hospitalization, general anesthesia, and the longer recovery period associated with more conventional sinus surgery. But it is not meant to replace it.
Now, who's the ideal candidate for something like this?
First of all, it's a patient who you've already made a specific diagnosis that one or more of their paranasal sinuses are blocked, and they have not responded to medical treatment. It is a good thing to always try a reasonable course of medical therapy before offering this procedure. It is not the kind of thing where you walk in the office and say, I've got the perfect procedure for you. You really want to...
They have to make sure that it's for them specifically.
That's